evening. My name is Molly Anderson, and as Executive Director and on behalf of the Board of Trustees of the Atheneum, I welcome you to the second lecture of the summer's Geschke lecture series. Could you please turn off your cell phones before we get started? As the Islands Public Library, we offer at least 800 programs throughout the year. And none of that would be possible without the generosity of many, many donors. The Geschke Lecture Series, for instance, is made possible by a grant from the National Endowment for the Humanities and the Geschke Foundation and a number of wonderful donors who are in this audience. We're very lucky tonight that Chuck Geschke is here, and he's going to introduce our speaker tonight. Please join me in welcoming Chuck Geschke.
Thank you, Molly, and I want to thank all of you who are here this evening. I'm absolutely pleased and delighted to have the opportunity to introduce my longtime friend and colleague, Esther Dyson, to Nantucket. Although her visit here is so short, she's not going to get a very good taste of it. Esther was named by Forbes magazine as one of the most powerful women in American business, and is regarded as one of the most influential voices in technology. Esther is a study in contradictions, as you're going to learn tonight, and if any of you go up onto the web to look at her CV, you'll find that indeed she is full of a variety of different interests. She's widely regarded as one of the most influential voices in technology, but she herself is not a programmer or a high-tech executive. She began her career as a magazine fact-checker at Fuller's, and then ended up managing her own venture capital fund. In addition, she is an active technology policymaker in Washington. Esther was born in Zurich, Switzerland, to a premier mathematician, Verena Huber, and a physicist and futurist writer, Freeman Dyson. Her father worked at the prestigious Institute for Advanced Study at Princeton, New Jersey, and so at the dinner table she often dined with Nobel laureates. An aspiring novelist from the very beginning, she started her own mini newspaper at the age of 8. A little young. But later she worked as a page in the public library. She then entered Harvard at the age of 16, and by her own accounts, I didn't make this up, she rarely attended classes. Instead, she spent most of her time at the university newspaper, the Harvard Crimson, or hanging out with her friends at the Harvard Lampoon. She graduated in 1972 with a Bachelor of Arts in Economics. And although Esther hoped to become an entertainment writer at Variety, she ended up as a reporter at Forbes, where she became fascinated by the business world. And in 1977, she left print journalism behind and became a Wall Street securities analyst, specializing in electronics and technology. In 1980, she founded Adventure Holdings, that's spelled ED Venture for Esther Dyson, a pioneering information technology and new media company. Her career took another turn in 1982 when she joined venture capitalist Ben Rosen and took over Rosen's electronic news and industry newsletter, which she purchased the following year and renamed as Release 1.0. Her newsletter quickly became a must-read among technology executives like myself, and in 1983, she took over the PC Forum, which was an industry hot ticket for people like Bill Gates and the founder of Lotus, Mitch Kapoor, and others spent a lot of time as luminaries in that environment. In the late 1980s, Dyson became an active investor in Eastern European technology ventures. She also became increasingly involved in the public discussion about the future of the internet. And as co-chair of the National Information Infrastructure Advisory Council, the head of the Electronic Frontier Foundation, and the interim chairwoman of the Internet Corporation for Assigned Names and Numbers. Now that's a mouthful, all of those things. But she had the position from that to be able to help mediate and inform public policy regarding privacy, encryption, and the assignment of internet names and numbers. Her book, Release 2.0, was addressed to a non-technical audience and presented in quite plain English the key issues and controversies surrounding the evolving world of the web and the internet. This evening, Esther is going to discuss her current venture, which is named Geschke. And it really is focused on a project named the Way to Wellville Challenge that's designed to produce dramatic improvements in health in 5 communities in 5 years. Esther, welcome to Nantucket.
So, thank you, Chuck. It was a great intro, and I'm going to talk about something entirely different because I did all that, and I have a saying which is never take a job for which you are qualified. So I'm going to give you a very brief story of how I came to Hiccup and what we're planning to do. My partner here, Karen Watson, is on our advisory board, and so you can ask her questions as well as me. Anyway, I'm going to give you about 10 to 15 minutes of that, and then do Q&A. And I'm happy to talk about Way to Wellville. I'm also happy to talk about what it's like to train as a backup space tourist, or some of my experiences in Russia, or internet stuff, or ICANN, whatever. So let me find the arrow key here. Okay. So here's the context I came from. PC, you heard it all. I wrote a piece on the impact of the internet on intellectual property, and it was a cover story in Wired magazine. This was sometime in the 90s, and it aroused a lot of comment. Hillary Rosen, who ran the Recording Institute of America, it was basically the record companies, invited me to speak, and I got dinner rolls thrown at me, but I enjoy that kind of stuff. So with luck, you won't throw dinner rolls here, but we'll see. Having done all this, this is where the story begins. There was an X Prize for health. It was called the Healthcare X Prize for $10 million, co-funded by WellPoint, and the idea was to take 5 populations. In this case, it was most likely 10,000 covered lives. So 5 different populations that WellPoint would kind of, like what Facebook did, would donate to this experiment and see what happened. Only I think in this case, they probably would have gotten their consent. I thought that was really cool. I was beginning to get more interested in health as one of the more interesting things that data and digital technology might address. So I asked to be a judge on this prize, but nothing happened. They didn't talk about it much, and then suddenly, well, you know, it's not actually going to happen. So I kept thinking that somebody should do that. But at the same time, I was beginning to recognize that healthcare is basically the repair business. And there really should be some way to produce health rather than simply chase after it when it's too late. And I got quite involved in the quantified health, quantified self movement. Anybody wearing one of these, raise your hand and show it off. For a upper middle class audience, you're really not very instrumented. Whatever. So I spent a lot of time being fascinated by these devices. Most of them are really focused on people who, again, are upper middle class and maybe need a little more willpower. It's like, but unfortunately, at the very top, maybe the top 20%, the people who actually use them probably don't need them. In the middle, 60%, maybe wearing these devices will remind them to walk more, to eat less, to get some sleep, whatever. And then at the bottom 20%, it's not relevant. But in fact, that's not really the problem. And I kept thinking that someone should do something about this, and someone should run an X Prize for health, not just health care. And last year, I was at a Quantified Self conference. They asked me to make a few remarks, and I thought I'll talk about the X Prize. Someone else should do this. As you see, very lame talk. So I realized I would do it, and I announced it. And then I had to figure out what on earth was I going to do. So I organized 4 brainstorming sessions, somewhat smaller than this. People I knew who were interested in health or healthcare, I asked them to invite their friends and said, basically what I'm trying to do is a clinical trial, not for a specific diet or a specific approach, but for the overall concept that if you want to make change, you need to do a whole lot of things together. And rather than take a insurance company's population, take a real place. Don't try to find out whether a particular diet works, but find out, will people stay on the diet? How do you change a community, and how do you change the food supply so that it's easy for people to make the right choices in a world where we had a lovely dinner here, thank you. But most people don't have that option. So had some interesting brainstorming, and one person there kept asking these awkward questions, like, how are you going to measure things? How are you going to get people to agree to do this? How much is it going to cost? Can you really have an impact after 5 years? So I hired him. And that's him and me. I think we were outside Niagara Falls on a visit to what is actually a very troubled place, despite its great name. And he's from Cigna, knows how to wear a suit and talk politely to insurance company executives, which, as you can imagine, is not my forte. And it's been totally wonderful. So HICCUP, which was Health Initiative Coordinating Council, Rick, having somewhat more of a marketing mind, changed it to the Way to Wellville. So HICCUP is the organization I founded. The Way to Wellville is our project. 5 places, 5 metrics, 5 years. And it's, as you see here, a pseudo-clinical trial, something that would make a scientist gasp. But the goal is not so much to persuade scientists, though we're going to be collecting data up the wazoo, but to persuade normal people of how they can change their community. And ideally, we'll have an impact that it's not simply scientists exploring the data and doing a regression analysis can find a 2% impact, but something where the mayor's proud, employers find it easy to bring people into town, high school graduation rates go up, and oh, by the way, the people look healthy and they're out sick less. So this is the only slide with a lot of words on it. What is a clinical trial 2.0? It's not just the health stuff, it's also funding models. How can you create sort of the equivalent of mortgages? Instead of renting your health month by month, how can you invest in it? How can you get someone from outside to invest $10 million up front if you're going to save $5 million 3 years out on diabetes treatment? How can you get people to understand that they're being manipulated by advertisers, not because advertisers are evil, but because that's their job, and give them the tools to manipulate themselves? We're going to have a cheesy reality TV show, and we're going to move from quantified self to quantified communities. In other words, we're not necessarily going to give everybody a tracker and make them do stuff. We're going to change the environment in which they live. Bike paths, school lunch, employer wellness programs. But in the end, we're not waltzing in a nice white lady from New York and telling people how to live. We're asking them, what are your problems? What do you think would help to solve them? Let's work together to help you get money, help you meet experts who know how to deal with nutrition or school lunches or whatever. And ultimately, let's get the food companies to come in and offer pilot healthy foods using your community as a test market. So the slides aren't in the order I expected. For the last year, we've been thinking about doing this, and as I fly back and forth across the country, because I'm still in the tech business, I look down and I see these places and I think, could this be Wellville? Because that's the kind of place we want, not a giant city, but a smallish, under 100,000 people, somewhat remote place, so that if you change the conditions, people aren't going to the next place over to get a milkshake and fries. We can't outlaw the milkshake and fries, but we can make the alternatives much cheaper and more accessible. So these are our core constituents. This is where change really happens. And if you come in and tell people they need to get healthy, they may not be that interested. But if you tell them it's for their children, and of course children are more malleable, it's easier to help them change their behavior. And one of the greatest markets to study is school food, because every child eats it, and right now it's pretty horrible and unhealthy. But the most amazing conference I went to this entire year was a conference called School Food Focus in January in Oakland. It was about fixing school lunch. And I expected pictures like this, heartwarming little children eating nutritious food. Isn't it great? And what I actually heard about was procurement and logistics. Most schools no longer have kitchens. The people in them aren't trained to cook. They're trained to take boxes off trucks and pour things into vats and heat them up. And so this is a nice picture, but it isn't actually what I learned. And as I said, we also want to go to the food companies. All of them know Armageddon is coming. How many of you were here for Walter Willett last week, or whenever it was? Yeah. Walter Willett and people like him are beginning to be heard. In England, they've got red, yellow, and green on food. In Mexico, they're taxing sugar. And every food company is aware of this. And most of the people in food companies are parents. They want the best for their children too. I mean, I don't know what they all think of when they go home at night, but they're not trying to make people sick. They're trying to do a decent job and make money. And so they all have test kitchens, they have secret projects. One of the people who came to one of my brainstorms was a man who owns 6 McDonald's franchises and told me he was ready to go to their innovation committee when I was ready. And pretty soon I'm going to call on him. So we want to offer a demilitarized zone to these food companies where they can try to make healthy food not just cheaply, but also delicious and good looking, whatever. And their competition will be doing the same. We want this to be profitable for the food companies, or it won't happen. So just to give you a little progress report, we are now at the site visits, and on So Rick and I, our CEO, we realized you can't really raise money for a great idea. And as all of you who raise money, it's much easier to raise money for projects, for tangible things, for real things, not for two people sitting in New York and Connecticut. So we realized we just have to go out and find some communities, and then we can get started. In April, we created an application form, and having gone to all these conferences and giving talks and so forth, we actually got the word out. We got 42 communities applying. They had to be under 100,000 people. They had to have, if you like, social capital. We weren't going to try and fix them. We wanted them to already be on the way to Wellville. We just wanted to help them accelerate. And we had promised to do only 5. So we had to get a short list. And then we read press, like what, Athens County, Ohio, loses. And it broke my heart, because all these places had already done this application was a real bear to fill in. You had to put in a whole lot of data about your problems and what you're doing about them, and get all these coalition members to sign them. They were mostly, 40 megabytes or something a piece, Karen? Yeah. So we thought, well, we'll create this second circle for them. And then another great name appeared. It was Greater Wellville. So we've now got Greater Wellville with 41 communities in it, but we also still need to find the Wellville 5. We narrowed that down to 10 communities. Karen and I and Rick visited the first one on Friday in Scranton, Pennsylvania, where they brought out a marching band, bagpipes. We really were hoping more for like a workshop or something, but anyway, tomorrow we're going to Oxford County, Maine, and then we're flying from Portland, Maine to Portland, Oregon to visit Clatsop County. And anyway, you don't need the whole list, but that's August 11th. We'll visit the last one, which is Clinton County, New York. And then we'll have to pick 5. It may end up being 6, but it's not going to be 10, because it really does require a lot of resources and attention. And if you ask questions, I can tell you more about what we'll be doing specifically. So this is our grand tour with, as you can see here, a little time off for a pre-existing condition in Aspen. These are airports. Most of these places are actually 2 or 3 hours from the closest airport. And this is what we're looking for, impact that you can see. So with that, let me thank you for your attention and open up for questions. And am I supposed to, I'll call on you, and if you can say something like who you are, or especially I'm a doctor, or I'm a food company.
So I'm just a community member. I live in Connecticut, have an apparel company in New York, and got very interested in education. Started an after-school program about 15 years ago in my local community. So I've always been interested in social change. About 5 years ago, I went to a very major food empire in New York and said to them, how about if instead of the franchise that you have created that's so powerful, how about if you do something that encourages people to eat really, really well and turn that into a very cool, because he has fabulous reputation and everything they do is top notch. And I thought you'd be interested in the response was, we don't want people to think about the French fries that we serve. Thank you for coming in. I can set you up with some other people, because I had a whole presentation of how delicious grilled fish and chicken and vegetables and all of this, and we can hire chefs from the CIA and partner up with Weight Watchers and really change the way America eats. And that was an interesting response. I was very sad. We don't want people to think
Yeah.
too much. Thank you for coming in. But I also wanted to ask you, are you familiar with Wholesome Way? Michelle Nishan's movie?
Yes. Karen knows him well, and he's coming to speak at our conference. And
Okay, good. He's
Thank you.
a good friend.
Yeah.
And they're doing a lot of his double coupon value for at-risk communities. Good.
so kind of along those lines, I was at a meeting and I ran into the CEO of Rite Aid. This was before CVS stopped selling cigarettes. And I asked the Rite Aid man, so have you ever considered, very politely, have you ever considered stopping selling cigarettes? Because this was actually at a health care meeting. And he said, excuse me for being so blunt, but you people should have the balls to get the government to stop us, because we won't do it ourselves. And at least he was candid, like your man. And then a month later, CVS changed. So that's the kind of thing we're hoping for, and we're in touch with Rite Aid in, maybe not with them, with that guy directly, but we're in touch with Walgreens in particular. In fact, I was at a conference in Aspen where I met, you know how these things work, you ask to meet somebody. So I asked to meet the Chief Innovation Officer of Walgreens, who was there at a health conference in Aspen. So I told him the story I've told you, though much quicker and without slides. And he smiled and said, interesting, you may not know this, but I was the guy at WellPoint who was trying to make this thing happen. So it was like meeting the biological parent of your adopted child. And God bless him, he didn't say, you're messing up my child. He said, any way I can help, I'd love to. That doesn't mean he can single-handedly get Walgreens to stop selling cigarettes, but it's beginning to happen because they're beginning to see this change. And what we're trying to do with Wellville is, it's collective action. Go into communities that want to do something, help them do it at scale, and then make it visible. But ultimately, what we're trying to do is give evidence and examples and inspiration for what would look like government intrusion if you didn't have the evidence and the examples and the stories and the narrative. There and back.
So I have nothing to do with food or nutrition. I'm a retired IBM and I've used for a very long time. What are the 5 metrics? And describe the populations that you're trying to address. Are they just those within a geography?
Yes.
Yeah. And what are the 5 metrics?
Okay.
that you want to-
So the 5 metrics are, like everything else, we haven't figured it out yet. My version of the 5 metrics is medical cost per capita, and this is obviously changed in whatever the metric is over 5 years. Transitions to diabetes per capita, high school graduation rate, unscheduled paid time off, and then something that's either dental or mental health. Rick's metrics are more like indices. You're an IBMer and sort of techie. So one would be a health composite, another would be a social welfare composite, another would be a sustainability composite. We're having a meeting sponsored by the Institute of Medicine with a bunch of researchers and other people interested in August, to which we've been invited, a lot of other people invited, and they want 5 people from the same community to kind of give a holistic view of what people in the community care about. So the answer is we haven't defined this yet. It's ultimately going to be defined with the 5 communities when we meet with them all in September at a conference in Tampa that is being held in conjunction with a health company. So we're still listening is the short answer. But anyway, that gives you some idea of the kinds of things we're looking at. It's fundamentally the question of, do you want something that's precise and specific and meaningful to people, but that could end up being teaching to the test? Or do you want something that's broader and covers more, but is a little more abstract. John Merson.
How do you imagine these 5 communities telling their stories and disseminating the information about what happened?
Cheesy TV show. And social media. I mean, we're really eager. So it was fascinating to go to Scranton on Friday and just see people want to be proud. They have to achieve something before they can be legitimately proud, but I don't think that's going to be a problem. We want the community. One thing we've been hearing as we've talked to the 41 communities is, even though people like to be proud and compete, there's a certain discomfort with the idea of competing rather than we'd like to share our knowledge, we'd like to help one another. You know, at some point we may be competing for money or funds, but at the same time, especially if you're in a community of 100,000, people don't call on you. One of the communities told us they had tried to talk to Safeway and their calls weren't returned. Yeah, we want to be the people to advocate for these small communities that are, you asked the question, geographically diverse. We're looking not for the best, the 5 best. We're looking for the best group of 5 that are indeed different. In one, a health system is leading the charge. In another, it's the county government. In another, it's an employers coalition. So we're really uncomfortable, as you can sort of hear, with the, you know, these guys qualify, they're winners, and these guys are losers. We wanted to be realistic. I mean, you know, these are tough places to live. People are unhealthy. There's crime, etc. But improving people's lives is just fundamentally, it's actually a really great story that I think we won't have any problem getting coverage for if we do the job right. And we want companies to come in and do things and then publicize their good works. But more than that, we want them to publicize the impact of their good works. And one thing I've noticed as I go around talking to all kinds of community programs, nonprofits, whatever, there's so little discussion of impact. It's all about what we did, how many people showed up, how many people participated, but very little about, did they actually get healthier? Did the crime rate really go down? There are some positive examples. One of the most interesting is what the California Endowment is doing in California. But in general, this movement of impact measurement hasn't really hit the health improvement sector that I can see. Yeah, way back there.
I'm retired also, I used to be in private equity. In one of Malcolm Gladwell's books, he talks about some small community, I think it was in Pennsylvania, where longevity was far above average and incidence of various diseases were far less than average. And I don't know if, he's a great writer, I don't know how sound those statistics are scientifically, but I don't know if there's anything that you can learn from maybe looking at a community like that.
We're looking at, there are lots of groups that have done some of this. There are communities, there's the whole Framingham study, there are the CDC's Beacon communities. So we're looking at everything, and frankly, we're not trying to go in to the extent that people are already doing a program or two, that's great. So 2 of the places we're talking with are probably going to be doing the blue zones, which is, Dan Buettner did a similar study and likewise found certain communities that were just healthier than others. And he has a whole program that he's now doing in conjunction with Healthways. So what we're trying to do is take those things and leverage them. I don't know about that one in particular, but that's what we're doing with the Institute of Medicine. We're not trying to reinvent the wheel. We're trying to reassemble the spokes. But thanks. Okay.
What are the most important constituencies for you to get behind you in each community?
Yeah, so one is the health system, obviously, because it's not simply nutrition and bike paths. It's also better health care, better preventive services, and the Accountable Care Act, which now pays health systems for preventive services and actually for keeping people out of the hospital. And that is really, really helpful. Many health systems are not designed like that, and the move to being an accountable care organization isn't easy, but at least in principle, they're aligned with what we're doing. In practice, you know, sometimes yes, sometimes no. A lot of healthcare systems really don't understand community health. So they're very important. And in essence, we're trying to, if we're not trying to steal the revenues, we're at least trying to get their people to move out of the hospitals and the clinics and out into the community. Second is employers, because that's where the money is. It's either Medicaid, Medicare, or it's employer insurance in one form or another. And they're the only institution that really benefits from people being healthy, other than the cost issue. They actually like people to show up for work. So they're extremely important. Then there are the schools, the government, the not-for-profits, but fundamentally the people themselves. And I mentioned the food companies, but one thing we're looking for when we go to these communities is, are there not a lot of nice rich people talking about the poor people and giving them things? Or are the poor people themselves in there active, leading the charge, saying this is what we want, as opposed to passively receiving stuff? We had a great time in Niagara Falls where the mayor of Niagara Falls, Paul Deister, grew up there, went away, and then came back to kind of fix his city. And he's a very modern guy and officiated at the first gay wedding in New York State. And at the same meeting with the mayor, there was also Pastor Tim from a local African American Baptist church. And he had been at that same gay wedding carrying a sign saying, "God shall smite thee." But they were together on this issue of the community's health. So that's the kind of thing that we're looking for. Okay, in the back, and then I'll come up here.
So I run an entrepreneurship education organization, and I'm a professor at the University of Texas. And I was just curious about who are the model communities who you'd like to emulate, that are the healthiest, that when you're done, you hope these people are like these people in this other community, whether that's in the US or abroad. And so who are some good examples?
I wish there were some. I mean, maybe Aspen, but I'm not sure it's relevant. I mean, this is the problem. There aren't a lot of places where the food is good, the people are all healthy, the kids all graduate. You know, maybe in some manufactured community somewhere, but we're trying to make that exist, to be those model communities. You know, Grand Junction, Colorado in general is awesomely healthy by comparison, but I don't know. Yeah. You.
Hi.
And then Nan.
I'm Vincent Everts. I'm from Netherlands, software entrepreneur. Describe that community. How do I come in? It's 100,000
okay.
people. How many people are selecting that thing? Is that 100 people who's basically put in that application?
Yeah.
And then in 3 years, what will I see there? What will be different in that community? What do you envision now? Because obviously that vision is not ready yet.
Well, so ideally, as I said, it's not 100 people. It's a lot. It's more grassroots. One interesting phenomenon is if you go to a place and they tell you, "Oh, we have 400 different charities," that's actually not usually a good sign. It means that they're too small and they don't work together. So you want organizations with some critical mass, and you want a broad spectrum of people. But you know, if the world were perfect, they wouldn't need us. So we're actually, I don't want to name names, but there's one place that's really desperate. And in a sense, the proposition there is there's not a lot of local social capital. There's a bit. There was enough to apply. But if we can bring in some outside support and help make things happen, will it work, or does it really work only if it's bottom up? And can you, in fact, create that bottom up energy, which some of what the California Endowment has done would indicate that you can. I mean, of all the communities that I would follow the example of, it's probably the ones that the California Endowment has done, but they're not all the way there yet. So what we see now when we go in is abandoned houses, fast food joints everywhere, not food deserts, but food swamps. In Niagara Falls, the smoking rate is 37%, partly because they get cheap tax-free cigarettes from the Native American casino around the corner. But that's really good news, because it shows that incentives and disincentives work. And what we hope to see in 3 or 4 years is farmers markets, people cooking food at school and being proud of what they serve to the children. Children having a healthy breakfast. That does not mean a Pop-Tart. It's one thing to serve breakfast to kids at school. It's another to serve a healthy breakfast with protein and without too much sugar that will actually keep them going until lunch. Employers active, holding, you know, one thing that really makes these places sing is when the schools and the workplaces become places for health as well. So recess, gyms at work, a nurse in school, healthy food everywhere. There's this phenomenon called,
Like Google.
like Google. Walking school buses where the kids walk to school in a line with somebody making sure they cross safely. In some of these places, parents don't like to let their kids go out to play because it's dangerous. So it's not simply the nurses and the food people that need to be involved, it's the police and local community things. On Friday, we went to visit a neighborhood club of some kind, and there were little kids climbing up rock walls and then jumping off a ledge with in a harness and so forth. And this kid that jumped off and was safe, he's going to feel invincible. More stuff like that. And the people who were keeping the kids safe were many of them teenagers who had gone through that program themselves years ago. Nan.
Well, I'm just thinking, sitting here and thinking about...
Can you, nobody can hear you.
Nan Geschke. I'm thinking about the marketing challenge on this project. Have you thought about your message? And how are you really going to be able to attract the whole community?
Yeah.
I mean, you mentioned the TV show, but there's 1,000 TV shows. And who knows if this one will be watched.
Yeah. Could you hear him back? No. How are we going to market this? Not so much with the cheesy TV show to other people, but within each community. That ultimately is up to the community itself. I mean, we can help them. There may be, you know, we don't know whether people are going to want to use our logos or have their own, you know, healthy Spartanburg as opposed to the Way to Wellville. They'll be part of the Way to Wellville challenge. Whatever resonates in their own community, we're happy to help bring in marketing people. We're happy to help create content, but I don't think it's going to be one size fits all because these communities themselves are so different. So there's no magic. And yeah, I mean, we don't have a clever answer to that, but it's doable. And likewise, we don't think everybody in town is going to be coming out and doing jumping jacks in the morning. We want to make it easier to eat healthy food, even if you're not signing up for the healthy eating program. Just the food around you, the people next to you, what's on offer, what's promoted, what they're serving in school. The way we got so unhealthy wasn't by people deciding to eat unhealthy. It was what was available, what was cheap and easy, what tasted good. We just want to shift that back in the other direction. So it's not that we want people to go around consciously being healthy every moment of the day. We want the environment itself to be conducive to health and healthy food. And, you know, and this, yes, we want to double down on the anti-smoking programs and make the cigarettes really hard to find, especially for the kids. Once you start smoking, it's really, really hard to quit. But if we can get people not to start, that will be a huge victory. Okay, and by the way, I'm also happy to talk about tech futurism or whatever, but let me try someone, yeah, over there.
Yeah, have you done any research on what's been done in the UK with visiting nurses and what's been done here in this country with visiting nurses, where rates of teenage pregnancy and drug abuse and school completion have been greatly improved by having a visiting nurse every week in
Yes.
a family home? And I would think that that would be the direction of building community, having people live and get educated in healthy
Yeah.
ways. And
Could you hear back there? Okay. Basically, visiting nurses is one really key thing. My aunt, in fact, was what they used to call an almoner with the NHS in England, and now they call it a medico-social worker. She specialized in unmarried moms, as a good Catholic herself. But, so this is part, I mean, we haven't researched it ourselves, but people who know how to do this are some of the people that we want to introduce the communities to. I mean, this is what I'm saying. It's not as if we had some innovative new way to do something. That it's stuff you already know. It is visiting nurses, asthma prevention. If the kid can't breathe, try vacuuming the apartment and getting rid of the rodents. Feed them breakfast and lunch so they can learn. So there's very little that's new. It's simply doing it.
yeah, I mean, there's great longitudinal evidence that this works.
Yes,
And it works in the UK and it can work here as well.
it will, but nobody knows about it because it worked with a small subset of people to whom it was applied, and we want to do it in places small enough that you can do it at critical density without it costing $500 million. Okay, orange shirt. Yeah.
I'm Dennis Shapiro. I'm a retired and probably obsolete electrical engineer. Metrics is very important here. Personal electronics, you wave your wrist.
Yeah.
How important is that to your program, and will that be a requirement?
So in the back, the quantified self stuff, the wristbands, whatever, how important is that, and will it be a requirement? No, it won't be a requirement. That's the world I came from. And I talked to one venture capitalist about this idea I had. He said, oh, you know, I don't think that's really necessary. Everybody will be wearing a fuel band in 5 years. And to which I didn't say it, but I thought, you should fly commercial more often. We would love to have Fuel Band and Jawbone and everybody else come in and offer free devices to anybody who wants them and sign them up for studies. But we don't think that that's the answer. I think it's going to be really interesting, and the more data we can collect, the better. But we don't think it's really the key to this. It's fun, it's the key for some people, But given my background, it's not what you would think. I'm not as excited about it as you would think. So, but people who are interested in it, again, the whole point of Greater Wellville is to say here are 41 communities that are interested in doing new health improving programs, and if you want to try something out, this is a place you can go to do a pilot project. Okay, in the back, the woman first and then the guy right at the back.
I'm just wondering, you mentioned prevention of diabetes as a parameter of the study. And I'm wondering if you considered supplementation with vitamin D and safe exposure to sunlight in terms of the effect it can have on prevention of diabetes and cancer or disease, et cetera, as being a really important piece of this.
Yeah, as I said earlier, it's about prevention through vitamin D primarily. Yeah, we are not going in with things that people need to do. We're going in and saying, what is it you would like to do to fix these problems you have? And if someone wants to offer to this community to do a study, we're delighted to help facilitate that. But it's not really, we're not deciding what they should be doing.
But if there's hard science to show that
If there's hard science, that's great. Then whoever's trying to do it should come and talk to these communities and persuade them. Because, and you know, maybe they'll persuade some subset in the community to do it, and then they could actually do a real clinical trial in this community that would be interested in working with them. And right behind you.
Yeah, excuse me, a little pivot over to the tech side.
Okay.
But along the same line, sort of the intersect between the wearables that which I don't have, but many of my friends do, and the delivery of healthcare into the future. I mean, what do you see as that technology intersect?
Yeah.
Are you bullish on it? Do you think it's
Yes, I think this is tremendously exciting. These things are mostly accelerometers. Some also measure a few other little vital signs, but they're not terribly deep. Within 5 years, we'll be wearing stuff that can easily monitor our blood glucose level. It can detect other things in our blood. They'll be able to detect tiredness. They'll probably be checking your brain waves to understand how you sleep. They'll give you early warning signs of things. The most interesting thing, I think, though, is kind of like what we're doing. It's the tangibility and immediacy of seeing the impact. So, again, we're not telling people what to do, but I have some pet projects I would love to see. And one is that you have children eat a donut, test their blood sugar level one day, and the next day eat a healthy breakfast and test their blood sugar level. And then in every kindergarten class, you have the mouse house. 2 mice that run, 2 mice that are sedentary, 2 eat well, 2 eat badly. And then the one piece of sleazy marketing I want to do is have people for the ethical treatment of animals sue us because we mistreated the mice. And this is how we treat our children. So back to your question, simply non-invasive blood analysis is going to be very interesting, both for treatment, but I think also for prevention, because there's so much that's happening inside you that you can't really see. If you have a device that can actually show you what's going on, again, not for everybody, but for many more people, simply seeing the impact of their behavior. If you could actually quantify how many of your lung cells are dying every time you smoke, those numbers are kind of interesting. Okay, Molly, you have to stand up too.
If you're interested in impact,
Yes.
which is what I think I'm hearing you say, talk to me a little bit about why you chose 5 years? It seems like such a short time to
Yeah.
measure impact. And then how do you sustain it
Okay.
after the 5 years?
Why did we choose 5 years if we're interested in impact? And then what do you do year 6? We chose 5 years because partly I just stole from the X Prize and didn't, but partly 5 years is not long enough to fix everything. It is long enough to show an impact. And I went to talk to a guy called Prabhat Singh who's done things like this in India, the 10-year Millennium Project or something. And he told me 5 years is too short. But 10 years just seems impossibly long. The whole goal is to build things, again, to invest. Not to do something for 5 years and then stop, but to do something that persists, like fixing school lunch, like changing people's tastes. When we went to Niagara Falls, same thing. Pastor Tim said, we don't like people who come in here and do programs and then leave after a year. We're well aware of that, which is why we're trying to find sustainable financial models and figure out how to make it profitable for companies to sell healthy food. It's good to subsidize healthy food, and we'll be working with WIC and SNAP and government programs. And in some cases, in order to do some of this, you need to get permission from state legislatures, which is what we're willing to do and hoping to do when a small community couldn't. But we need to show enough progress that people want to continue it. 5 years is short, but it's also long. Vince again.
Can you tell us a little bit about how you're going to do this, your initial financial planning, how much money you're going to raise, what's the business model going to be, where can we buy the investment or the shares?
Hiccup is not for profit, and I'm trying to raise money from everybody from Bloomberg. As I said, trying. This is not, and random billionaires I happen to know. Anybody in the audience, please come see me afterward. For the communities, so we need something like 5 million, plus we hope a 5 million prize of some kind. The communities are going to be spending somewhere between 20 and 80 to 100 million apiece. In many cases, that's much easier because there's somebody from that community who went off and made good and wants to come back. There's the California Endowment in California. There's Kresge in the upper Midwest. There are Silicon Valley billionaires who maybe we can persuade to get interested in Lake County, which is just 3 hours north. It's going to be a combination of grants, of vendor pilots, of social impact bonds, and we're talking to a lot of financial people who are indeed, if you can actually make a business case, if you prevent most attacks of asthma, you actually save a lot of money over what you spend dealing with people having asthma attacks in the emergency room and so forth. You need to construct the financial thing so that the money you save comes back to the original investor, or at least some of it. So there are a lot of people interested in doing that on Wall Street. They don't have very many examples of investment opportunities. We want to provide some to them. And I showed you my timeline. We're right at the beginning of this. We're getting huge amounts of interest. It's now our challenge to turn that into tangible, specific projects and programs with tangible, specific places that have at least some capacity to carry them out. And we will be bringing in researchers from outside and so-called navigators/coaches to help make this all happen. Okay.
Do you expect hostility from the big food companies?
Do we expect hostility from the big food companies? In some places, yes, but we need to work with them because there's a guy called David Friedman. He wrote, you should have him speak here. He wrote a great article in The Atlantic called How Junk Food Can Solve the Obesity Crisis. And that was an editor's error. It really should have been called How Junk Food Companies Can Help Solve the Obesity Crisis. These are the outfits that deliver the food. Farmers markets are part of it, but if we can't get the food companies on our side, it's not going to happen at scale. And that's why we are trying to be really friendly, go to them to offer these test markets. There will probably, I mean, a food company would be stupid to say, we don't believe in health. But they will say things like, our foods are not meals, they're only snacks, and therefore they don't need to be healthy. But we want to work with them. And, you know, I'm sure there will be some that we won't be able to work with at all, and others, you know, there's Chipotle's, there's a spectrum. And so you have Rite Aid on the one side with the cigarettes, and you have CVS on the other. And I think you'll find the same thing in food. And CVS, its stock went down for a moment, but then it went up. Yes?
Dr. Perry has done some really interesting research on the longitudinal effects of not investing in children, and then they end up incarcerated.
Yeah.
And it costs $30,000 plus a year to have someone incarcerated versus making an initial investment in a child so that they don't become incarcerated. And that could be, I think, a compelling argument for investors to say that you could have.
It is. And now you just need to structure a bond that actually allows them to invest in that. The very first one was the famous Goldman Sachs Rikers Island recidivism. And that's the kind of thing we're trying to do at scale, because there are lots of people who are saying exactly this. Yeah, I'd invest in that. That makes sense. But where's the financial instrument that will let me do that? And so, seriously, anybody who is interested, come give me your card afterwards, right here.
My name is Kathy Barriers. I'm the CEO for a healthcare company and a healthcare nonprofit in New York, New Jersey, and Connecticut, probably serving a lot of your communities with preventative healthcare in the vision end of healthcare, eyesight, trying to save eyes. And one thing we do is deal with the 3 to 5-year-olds, almost primarily in our markets. The other big market is diabetics, adult diabetics. And the 3 to 5-year-olds are our target for all the reasons that have been brought up. But we also partner with so many significant organizations in New York, such as the Children's Health Fund, which you may be interested in researching a bit. And they cover all of the spectrum of diseases that children can get as youngsters. And one of the questions I have for you is, how do you go to a community that is culturally diverse, coming from different ways of thinking about food, using food? How are you going to, I know you say you don't want to tell them what to do, but somewhere in the middle between telling and you have to educate them about how to eat better. It's all related to every other chronic disease, including eye disease. So certainly we're concerned about healthy eating as well.
Yeah.
I'm just curious about that.
I mean, again, there's no magic. We're visiting these 10 communities. We're asking them, what are your biggest problems? How do you want to solve them? How can we help you? What is it that you're lacking? Is it marketing material? So in my bag, I have marketing materials around healthy eating in Spanish. You know, there are lots and lots of these programs. There's no shortage. We need to help make them successful. And one way to do that is by having different approaches for different communities in the same community and doing things at scale so that then it becomes believable and somebody says, yeah, you know, I'm seeing what's happening in this community. I'm happy to invest because I can tell that their diabetes management program is going to be more than averagely successful because of all the supporting stuff around it. And, you know, it's simply, it's like long, long ago when I was on Wall Street, some CEO said, we're going to improve our pricing to make our products more attractive. And someone said, well, how are you going to do that? And he said, well, we're going to pay more attention to it. You know, I mean, there's no magic answer, and it has to come at least partly from the people there themselves. But along with scientific evidence, programs, you know, what has worked in other places? It's worked in other places, and you could figure that out if you did a regression analysis. But if you do it here with other things interacting, it will actually have a visible impact. I don't know about timing, so one more question. Oh boy, yeah.
This is a further pivot.
Okay.
Into tech, since you've said you've answered
Right.
some questions. I'll assert the hypothesis that all sense of security and the internet, as we move ever more to the cloud, is an illusion, whether it's because of government intervention or other forms of hacking. Bloomberg just this week published a story about how NASDAQ got basically hacked, I think, by Russian hackers. Where does it end? And the implications for business seem immense.
Yeah. What a depressing question to end on. You know, I mean, to some extent, I think we need to take a public health approach to security. We need to get much, you know, starting with kind of the really low-level stuff. We have health insurance, and I don't think it wouldn't be politically possible to tax diabetics more for drinking milkshakes, but we can tax users more for, not for unsafe practices, but for not using antivirus. I mean, the first thing we should do is we should just really fix the underbrush so that the other kinds of attacks become more visible. And that you know, that's starting with spam. No, we're completely insecure, so we need to develop better security protocols. We need to keep our grid separate from the internet. We need to, you know, it's public health stuff, and we need financial incentives to do that better. And the moral issues are much less than individuals' eating behaviors, so in theory it should be more soluble, but people need to understand there's a problem first. I'd really like to cheer you up. I want to thank you all very much for coming out on this gloomy night, and my email address is edyson@hiccup.co if you have advice, contacts, money, you know, health companies or scientific evidence or anything. And if you want to follow us, please do at hiccup_co or The Way to Wellville on Twitter. And thanks a lot, everybody.